Technology and medication administration. Medication administration is a vital part of healthcare. Medication therapy is one of the primary interventions for many illnesses. Although medication therapy is very effective, there have been increasing errors of medication administration. The integration of technology with healthcare has improved the outcomes of medication administration. There are many advances in technology that make medication therapy much safer for patients and adds an extra security measure for healthcare providers. The safe and accurate administration of medication is one of the major responsibilities of a nurse. Nurses must have thorough knowledge of the drugs that they administer, know generic and trade names to be administered, know abbreviations and symbols used in prescription orders. The routes of medication administration are oral, sublingual, intradermal, intramuscular, subcutaneous, intravenous, inhalation, topical, suppository, buccal, and rectal. There are 5 rights of medication administration. Right patient. An important step in administering medication safely is being sure the medication is given to the right client. Identify the patient by asking the patient to state their name and date of birth and check their armband. Compare the name and medical record that is on the medication administration record with the information on the armband. Always use 2 forms of identification when identifying a patient. Be sure to never use the room number. Right drug. Check the bottle's label against the physician's authorization. Be sure to compare the label on the medication to the MAR in the patient at least 3 times. No indications and side effects for each medication. Right dose. Validate the calculation of doses with another nurse. Know the safe dose and question any dose outside of safe range. Right time. Standard administration times are set by each facility. Medication can be given 30 minutes before or 30 minutes after the prescribed time. Know the last dose for administration of any drug. Right route. Be sure to administer the medicine at the prescribed route. If a certain route is contraindicated, request a new order from the physician. Client rights related to medication administration. The patient has the right to refuse the medication regardless of the consequences, to be informed of medication's names, purpose, action, and potential undesired effects, to be properly advised of the experimental nature of medication therapy, and to give consent for its use. Medication and safety guidelines. Medications are not given without physician's orders. Labels must be clear. Do not administer a drug if there is any doubt and check with the physician. Do not pour medication from one bottle to another. Information technology safeguards. Information technology safeguards help to reduce or eliminate medication errors with the use of computerized physician order entry, or CPOE, barcode administration, BCMA, and e-prescribing. When properly used, technology such as automated drug dispensing systems, smart IV pumps, electronic medical records, computerized documentation at the bedside, barcoding, and CPOE reduce adverse events through the introduction of additional checks and balances to existing systems. Computerized physician order entry. Computerized physician order entry is the process by which the physician or another healthcare provider directly enters orders for patient care into a hospital information system. Benefits include a reduction in transcription errors, a decrease in elapsed time from order to implementation, standardization and more completeness of orders, fewer medication errors, and the ability to incorporate clinical decision support, alerts from critical lab values, and prompts when certain tests are due. Information is drawn from separate systems such as the hospital, pharmacy, and laboratory systems with drug databases to warn prescribers of potential problems with dosages, potential drug interactions, allergies, and contraindications such as pregnancy or other health conditions. E-prescribing. E-prescribing refers to electronic transmission of drug prescriptions from a hospital-based inpatient ordering system or handheld device. Advantages include fewer errors, improved communication, greater efficiency, improved compliance with recommended treatment guidelines, lower costs, and less time to fill prescriptions. Errors are reduced because problems with illegible handwriting are eliminated, and the system incorporates lists of patient allergies and other medications. Information may be available that suggests the best drug for a particular problem, dosing recommendations, drug interactions, contraindications, off-label uses, allowable formulary drugs for a particular individual, and insurance copayments. Barcode and radio frequency identification, or RFID. Barcodes come in simple linear format or two-dimensional forms. Linear codes can include the medical record number. Two-dimensional forms can include more information such as the name, age, provider, and gender. The technology is inexpensive. It does not require line-of-sight scanning, which requires awakening or repositioning of the patient. It may not read well objects that have been bent, wrinkled, wet, or torn. Radio frequency identification is durable, can contain more information, does not require direct visualization, and may be reprogrammable. It is available in passive and active forms. The passive form contains a chip and antenna and is generally small and may be flat. The active form uses batteries and transmitters to constantly provide location information, making it ideal for tracking equipment, patients, and even staff. It tends to be more expensive. Barcode and RFID medication administration. The FDA issued a rule in 2004 requiring barcodes on most prescription and some over-the-counter medications as a means to decrease medication errors by 50%. Barcode scanning technology automates the storage, dispensing, returning, restocking, and crediting of barcoded medications, improving safety by ensuring that the right medication is dispensed to the right patient, especially when used with barcoded patient ID bands. Barcode technology is available for IV infusion pumps for integration into the medication administration system, point-of-care glucose meters, and blood products. RFID technology can be used instead of barcode technology, but comes with a higher cost. Decision support software. Decision support software is a type of computer application that analyzes data and presents them in a fashion that facilitates decision making. It can incorporate lab values, standards of care, and other patient-specific information. It also contains alerts that help to promote safety. It is an integral part of CPOE and e-prescribing programs. The value of decision support software is contingent upon both the quality of the individual tools and the willingness of the users to use them. Thanks to new technological features, medication administration is much easier and safer to patients. It has helped decrease the amount of errors made by healthcare providers and reduce the risk for medication-related deaths and complications for patients. Technology is always changing and advancing, which means that researchers are always searching for new ways to make medication administration safe and reliable.